Thank you for considering to participate in the ASOS-2 trial. There are a number of reasons why you should participate. Firstly, this trial addresses a real and important problem. People in Africa die following surgery, and in fact it's twice as common than the global average. The second thing is, this trial will add substantially to what we know. We know that patients die in the post-op period from failure to rescue. And it's probably because we have limited resources. What happens is the patients develop complications. These complications go on to progress, and it results in mortality. We don't know, however, that if we provide increased surveillance for these patients, we'll improve their outcome. And that's what this trial addresses. This trial is pragmatic. It is very simple. It's very low resource intensive. And the idea is that it'll provide evidence for intervention which is implementable across Africa. Fourthly, it's powered for an outcome that matters. It's powered for mortality and not a surrogate outcome. And so if the trial is successful, we'll know that we can decrease deaths of surgical patients in Africa. Fifthly, this intervention is cheap. It relies on four things: either putting the patient in a high care ward, or increasing the frequency of nursing observations, or putting the patient closer to the nurse's station so that the patient is always seen. And fourthly, having the patient's family sit with the patient and flagging problems to the healthcare workers. We believe these four interventions are feasible. So if we show that you can increase survival in Africa through this, we think these are feasible interventions to be implemented across Africa. And finally, once the trial is complete and the trial is published, the data will be available to all the countries, and they can use it to look at other research questions they would like to answer. So thank you, and I hope you agree to join as a site in ASOS-2.